My name is Jocelyn Chertoff, and I'm the chair of the Department of Radiology. I grew up mostly in Manhattan, and I went to New England for my education, and I really liked New England. When it came time to look for a job, I knew I wanted to be in an academic medical center in New England, and there really are only 3. And I was lucky enough that Dartmouth was looking for somebody with my skill set. And so here I am, 29 years later. I really like it here, and I've been able to do everything I wanted to do in terms of my career here. I love living here. I like the changing seasons. I like the activities that are available to me here, and I have found it very convenient being close to several interesting cities. The thing that was most striking to me when I came here was the collegiality across the board. I did not see much in the way of turf wars or disagreements. People really had their eyes on what was best for the patients. And I think that's critically important, to make decisions with patient care as the foremost issue. It's really important to be happy, and I think that you have the opportunity to be happy here. I think that one of the things that you quickly see about radiology is that radiologists don't want to retire because they really love their work, and it's really fun. And really every day is full of interesting challenges. So I think you want to experience that as early as possible. And residency should not be a time of drudgery. It should be a really exciting time of discovery. I'm not sure I would agree with that description, but I would say I have always felt, to some extent, that it was my responsibility to take a leadership role where it seemed appropriate or where I felt that I had the skills. Several times I have felt that it was a huge stretch, but I enjoy a challenge and I really enjoy learning new things. And I think, like a lot of radiologists, I tend to have a short attention span. I like to move from one project to the next, and being a leader has given me that opportunity. I mentioned diversity. That's one of the really important issues right now. But that's not the only issue. And I feel strongly that I want to make sure that integrity and patient care remain key factors for our profession. I feel like the profession is moving, and should be moving, from a kind of a local culture to a more national and ultimately even an international culture. And I would like to see us be ready to make that move. Having the regional locations means that routine radiology is still available for all of the trainees to learn, but they will also have access to increasing sophistication of cases as we get larger and we have the ability to admit more patients. Our residents already do a lot of procedures. As I'm sure you've heard, that really has to do with the numbers of fellows relative to the number of residents. But our residents have frequently been in the situation of listening to a lecture on some procedure that they have done more of them than the lecturer. So there's a lot of opportunity for hands-on here, and I think the additional beds will mean that there are more opportunities. I would just like to say thank you very much for listening to this. I hope it was interesting. I think this is a wonderful place to live and a wonderful place to learn radiology, and I hope that you will consider coming and joining us.